Hi, my name's Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida. Really important topic that we're going to cover today. It's not just seizure disorder, it's how seizure disorder, non-epileptic seizures, which sometimes doctors will call it psychogenic seizures, dissociative disorder, depersonalization, derealization, movement disorders, how these all have a common cause, and that common cause is often ligamentous cervical instability in the upper cervical region, causing a block in the cerebral spinal fluid, the internal jugular veins, or compression of the vagus nerves. Some of the slides you'll see, I've duplicated them just because I want to take my time with this video, so I'm probably going to talk a little bit slower than I normally do. The importance of this topic cannot be overemphasized. There are so many people that have episodes, whether it's full-on seizure or they just have blanking out episodes, or they just know that something isn't right, like they feel like they're not even in their own body. And the good news is it's easily identifiable as far as what's causing it, and we'll talk about that. And then if there is a structural cause causing these disorders, then the treatment should be directed structurally. That should be the primary treatment. It doesn't mean that somebody gets off of their seizure medications, but we can, when we correct the structure, often the medications can be diminished or even not needed. Now, the traditional seizure disorder or epilepsy is a dynamic disorder of the brain characterized by sudden, seemingly unpredictable transitions to a seizure. And we all know, seizure that's called a generalized seizure, and it's diagnosed by EEG. I put this slide on here. It relates to dizziness, but it also relates to movement disorder, seizures, and changes in personality or cognition, just to show that they have a common etiology. So movement disorders, dizziness, depersonalization, personality changes, cognitive changes, like if somebody's memory's going down, or there's a change in the memory or a change in their personality that's sudden, or a person all of a sudden has uncontrollable movement of an extremity, or they have blanking out episodes. These all can have a common etiology, and the common etiology is normally some fluid flow is blocked that relates to the fluid flow of the brain. So obviously, if an artery, there's two arteries that supply the blood to the brain, the carotid artery and the vertebral artery. So if one of those or two of those are blocked, obviously the brain's not going to like it, and the brain might have uncontrolled activity, which we know as seizure. The cerebral spinal fluid, if the cerebral spinal fluid gets blocked, and it can be a block in the neck, or the internal jugular veins, which are the main drainage ports of the brain, if those get blocked, the pressure in the brain goes up. And if, for instance, if just a little segment of the brain senses increased pressure, just that area might then start firing. So give an example. If it's the sensory part of the brain that has increased pressure because of a CSF block or an internal jugular vein block, the person may just have all of a sudden increased sensory awareness. For instance, they could see multiple colors. They could smell flowers or some scent that's not even there. Right? So imagine somebody goes to a neurologist and just says, I don't know what's going on, but all of a sudden I'm hearing things, or I all of a sudden smell things when there's nothing there to smell. But if the part of the brain that relates to seeing, like the occipital lobe, or hearing, right? That part of the brain, if all of a sudden it has increased pressure, it would be as if you're hearing something because that part of the brain is stimulated, and that can be all because there's increased pressure on that part of the brain. So that's an important point. Then there's other people where all of a sudden they'll have a blanking out episode, and then all of a sudden one part of their body will start contracting. So the part of the brain that has to do with motion, that part of the brain is sensing increasing pressure because there's a block in the fluid flow out of the brain, so there's increased pressure on the brain. One other point on this slide that I wanted to make was episodes. Changes in cognitive status such as lack of responding to environment and or significant personality changes. So, for instance, somebody could be talking to somebody and that person isn't responding, and they're just blanking out. And I wanted to use the example of myself because there's times where Marianne's talking to me and I'm just, because my imagination is so vivid, I can live in a world that's not even a reality just because parts of my brain are so creative. So somebody like that who's right brain, because a lot of times these things occur in more creative people or more right brain people. And what I think it isn't that left brain people or analytical people can't have ligamentous cervical instability. I just mean for me to have episodes like this compared to Marianne, I need a lot less ligamentous cervical instability or a lot less compression of the jugular vein or the cerebral spinal fluid or kinking of an artery to get a symptom than she would, because parts of my brain are already so active, it just needs a little bit more activity. And I think this is one of the reasons why when people have unusual seizure disorder, blanking out episodes, or bizarro symptoms like they just get a little bit of a tremor in their one foot or a toe or a finger, right? And you go to a neurologist and you're already a right brain artsy person, they may say this is psychological, right? Because anybody who meets Marianne or me, they'd say the common sense person or the voice of reason is Marianne, the crazy person is her husband Ross, So I'm just saying, though, there's objective ways, and we'll talk about that, of documenting that there is a blood flow problem, there's a block in the cerebral spinal fluid, or there's an internal jugular vein compressive problem. And this is kind of an overview. Potential mechanisms by which cervical ligamentous injury can cause seizures. So cervical ligamentous injury causes excessive movements of bone. And we know that the vertebral arteries are actually in the foramina within the cervical vertebrae, and it loops through the atlas. And the atlas, or the top vertebrae, is how we can rotate our head. So if you have upper cervical instability, it's very easy for the vertebral artery to be kinked. Now, what's supposed to happen is if you have a normal circle of Willis, you can actually not get symptoms if one of your vertebral arteries gets kinked. That's what's supposed to be. But many, many people that we see here at the Hauser Neck Center have an incomplete circle of Willis. So they get kinking of one of their vertebral arteries, and the vertebral arteries supply the back fourth or back third of the brain. So when the vertebral artery gets kinked, some of the symptoms beside seizure disorder or seeing things that aren't even there, that's what I said, like all of a sudden somebody could see psychedelic things, they could see flowers, and they're not there, and people think they're crazy, but it's actually a type of seizure disorder. So symptoms of vertebral artery kinking are vertigo, dizziness, and then of course you can have basically various kinds of seizure disorder. Now, when the carotid arteries, which supply the major portion of the brain, this anterior 75% of the brain, when one of those gets kinked, you can have like a tonic-clonic seizure, like a generalized seizure. So that's over there. Now, when the CSF is blocked or the internal jugular veins are blocked, so that would be over here, you can get psychogenic non-epileptic seizures. So that means a person has seizure-like activity, but it's non-epileptic, meaning that when they do an encephalogram, an EEG, they don't pick up spontaneous activity that's consistent with a seizure. So in other words, it's just normal brain activity. So when they do an EEG with psychogenic non-epileptic seizures, they don't pick up seizure-like activity. I don't like this term, obviously, because the condition actually isn't psychogenic, as I'll show you later on. It's from ligamentous cervical instability. And then we know that vagus nerve stimulation is FDA approved for refractory seizures. So somebody has terrible seizures, drugs aren't working, they're getting breakthrough seizures, and if you do vagus nerve stimulation, then the seizure activity goes down. Well, if vagus nerve stimulation helps the seizure, maybe vagus nerve degeneration from ligamentous cervical instability is actually one of the etiologies of the seizure. And then stress is a common aggravating factor for seizures, dissociative disorders, non-epileptic seizures. So because stress makes it worse, that's probably one of the reasons why some physicians will give people the diagnosis that it's stress-related seizure disorder or psychogenic non-epileptic seizures, when realistically there are structural reasons for the seizures, and we can measure with ultrasound whether somebody's vagus nerves are actually degenerated. With ultrasound, we can find that the jugular veins are compressed, and we can document that the compression is from bad changes or destructive changes from the neck curve because of ligament damage. And the ligament damage we diagnosed by digital motion X-ray or motion X-ray. Epilepsy is thought to be a brain disorder, but is it? All fluids and neurologic input to and from the brain flows through the neck. Perhaps seizure disorder is not in your head, but in your neck. And I think this is really, really important for parents when kids are diagnosed with some type of seizure disorder, or there's a personality change, or the child's saying they're hearing things, seeing things, or they have blanking out episodes, and then they might have some movement disorders and nobody knows the cause. You should really look into, well, maybe it's a neck problem. And you might say, well, come on, why would kids be having neck problems? Kids aren't necessarily involved in car accidents and things like that. Yeah, but think about the average kid now. They have this itsy bitsy neck and they have this really large head, and they're looking down at tablets. Because of the large head and the very small cervical vertebrae, it's very easy for them to get ligament damage in their neck. And then we're all pretty familiar with the symptoms of seizure. You know, there can be loss of consciousness, but that doesn't have to happen. Like I would say, most seizures, you don't lose consciousness. And when people come to the Hauser Neck Center, they're normally saying, I'm getting like episodes. They call them episodes. They'll normally say that I'm aware of my surroundings, but I can't do anything about it. You know, so imagine that the person, you're trying to talk to somebody and they're blanking out, and you're trying, you know, and then it may just last 30 seconds. And a lot of these episodes, because for a very short period of time, their cervical vertebrae can be such where they move because of ligament injury. The bones can move in ways that they're not supposed to, so the cerebral spinal fluid's blocked or the jugular veins are blocked. And so they have a temporary increase in pressure on a certain part of the brain. And if that part of the brain has to do with consciousness, then it's almost like they're unconscious, even though they can hear and everything and they're aware of everything. And that's the episode. And I put this in there because it's normal when this first happens that the person gets an MRI of the brain. And the reason is, and I've diagnosed, brain tumors and people that came on. One time I had like a 7-year-old that came to the office and had kind of a very unusual kind of symptoms that related to their eyes, and they held their eyes kind of like this, the young person. And I said to the mother, I said, the standard of care before you even get here would have been that Charlie, I'll just call the child's name Charlie, that he would have gotten a brain MRI. Well, because the kids, they move around a lot, you actually have to have sedation, right? That's why sometimes MRIs in kids are delayed. Well, I said, no, he needs an MRI. Well, it turned out there was a brain tumor. So, so if you have new onset, weird symptomatology and personality, nausea, horrible head pressure, vision problems, blanking out episodes, it is the standard of care to try to get an MRI of the brain because you don't want to miss some kind of a brain tumor. Now, there's different stages of seizure, aura, the tonic phase where they actually have the seizure, and then, of course, after the seizure. When somebody has a seizure, you just got to make sure that they're safe. So you just make sure that the environment is safe. And then the standard of care is to try to see whether there's epilepsy or not. Like, is there an area of the brain that's firing nonstop? And is it both sides of the brain or one side of the brain? And then what side of the brain? A focal seizure is just one part of the brain, has autonomic electrical activity. Like if you think about a heart arrhythmia, it's similar to that. It's like an arrhythmia of the brain. An arrhythmia means that of the heart is the normal pacemaker of the heart is not what's causing the heartbeats, and it's another part of the brain. So imagine this part of the brain just boom, 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 boom. And if this part of the brain has to do with motion of my left arm, guess what's going to happen? All of a sudden I have a shaking or a tremor of my left arm. So for those of you who have bilateral tremors, right, in the office here we're starting to see more and more people, young people, in their 40s, I'm in my 60s, like much, much younger than me, having all kinds of tremors. If you have some kind of tremor, and especially if you're younger, I would definitely get evaluated for ligamentous cervical instability. Generalized seizure is where there's both sides of the brain have autonomic electrical activity, where the electrical activity is just going, 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 going. To stop it is normally medications. That's what traditional medicine uses, is obviously seizure medications. When I was in training, the go-to drug was either Tegretol or Dilantin, and obviously they got much more newer medications. And then it used to be, I think it still is, that you can't drive until you've been seizure-free for 6 months. So seizure activity is very, very serious because it can affect your ability to drive. Now, 1 in 10 people will have a seizure in their lifetime. So imagine if there's 370 million people in the United States, it means 37 million people have had a seizure. 1 in 26 people in the United States have seizure disorder. Again, that's what, 15 million people in the United States. It's the 4th most common neurologic condition. The most disabling condition in the world are neurologic conditions, and this is why. Because seizure disorder is the 4th most common. So what are the 3 most common? Stroke, dementia, migraine. Stroke, dementia, migraine. Now, on this channel, you've heard me before talk about that migraine headaches. Think about migraine headaches too. Often you have an aura. Well, why would you have an aura? Well, an aura is going to come from what? Electrical activity in the brain giving you the sense that you're going to have a migraine come up. And then Alzheimer's is where there's actually brain damage, like there's parts of the brain that are atrophying, shrinking, the brain cells are dying. Well, again, seizures, dementia, and migraine could have the same etiology, which is what? That you're getting block of the jugular vein. Like if you get block of the jugular vein, that means the waste products can't get out of the brain. Then the brain pressure goes up. The toxic metabolites from normal brain metabolism stay in the brain, and thus you could get where it overwhelms the brain and you actually get atrophy or damage of the brain. So the brain matter actually shrinks. And then when the brain pressure goes up, the arteries in the brain dilate. And what is a migraine headache? It means that certain arteries in the brain are dilating too much. So the people take what? Sumatriptan, ergotamines. They take vasoconstricting substances. So the etiology of migraines can be jugular vein compression causing dilation of arteries in the brain. And that's what we do in the office here. We actually can measure the arterial flow and see whether there's increased brain pressure and whether the arteries in the brain are dilated. And again, another pictorial of epilepsy. Epilepsy is the neurons in the brain, and there's anywhere from 1 billion to 5 billion neurons in the brain. And partial focal seizure, seizure starts in one hemisphere. It can stay in a very small part, so that's called simple partial seizure, or it can spread to other parts in the one half of the brain. That's called complex partial seizure. Generalized seizure mean it goes all over. And again, on EEG, partial or focal seizure looks like this, where a generalized seizure looks like that. The potential causes of seizure, there's a gazillion causes of seizure. Obviously, by the time somebody comes to the Hauser Neck Center, people have looked for these things, and I see the patient when they just don't have really good control. Now, if somebody has a structural cause of their migraines, or they have a structural cause of their seizures, movement disorders, blanking out episodes, tremors, obviously drugs aren't going to resolve them, right? Because there's a structural cause. So the etiology of a structural cause is normally ligamentous damage in the neck. Then you might say, well, doc, come on, I wasn't involved in some kind of trauma. I didn't play football. I wasn't in a car accident. I didn't fall down the stairs. Yeah, but if you look down at your cell phone, and you know, even when you're watching me right now, you could be looking down at your cell phone, right? You should have prism glasses and be looking up while you're watching this video. So when you hold this position, you slowly stretch the ligaments in your neck. That's called creep, C-R-E-E-P. And think about it, when you're in this position, you have a 10 to 12 pound head sitting on a 2-ounce atlas held together by very, very small muscles and very, very small ligaments. So eventually the muscles can't do it anymore. Then the ligaments stretch out, and it's very easy to loosen a ligament. It's very hard to tighten it. And when a ligament gets stretched out, you normally have to get prolotherapy to stimulate the ligament to tighten. So prolotherapy is an injection technique that causes the ligament to thicken and tighten. And depending on how bad the instability is, will depend on how many sessions of prolotherapy are needed. So there's three main categories of blanking out, staring episodes that I see in the office here. There's generalized absence seizures, partial focal seizures, psychogenic non-epileptic seizures. People are conscious but not responsive for a short period of time, less than 1 minute. All can be caused by changes in neck structure that inhibit fluid flow into and out of the brain. So like I said, it's normally either a block of the cerebral spinal fluid, and I'll show you illustrations of that, or the internal jugular vein. And when you get ligament damage in the neck, you get a broken down neck structure, which I term cervical dysstructure. So the cause of this is cervical dysstructure. Generalized absence seizures are also known as petit mal seizures. They are a type of epilepsy that causes brief staring spells that can be mistaken for daydreaming or inattention. So if you have a child, or all of a sudden you notice, like, you know, you're aware of your surroundings, but you actually can't do anything about it, you need to be checked out for generalized absence seizures. Partial focal seizures are a common neurologic disorder that occurs when abnormal electrical activity affects a specific area of the brain. These are often tied to, you have a blanking out episode, but then you'll actually get like a tremor in one part of the body or a movement disorder in a body part. Psychogenic non-epileptic seizures are when they do an EMG and there's no excessive electrical activity that's seen. All of these things can appear to a doctor or to a person exactly the same thing, where they have blanking out episodes where they're staring, they're holding a position where they don't seem to be with it. And the way you distinguish these two from here is whether they have epileptic activity on an EEG. Now I put this slide in here because often people who have these blanking out episodes will get diagnosed with depersonalization, derealization, or dissociative disorder. I did a video and an interview with Jason, so I'd really encourage people to watch my interview with Jason. Jason had very severe dissociative disorder, which is defined as a loss of connection between thoughts, memories, feelings, surroundings, behavior, and identity. And he went through our curve correction process here at Caring Medical, as well as prolotherapy, and had a dramatic change in his personality, and basically these symptoms went away. Often when people get diagnosed with derealization, depersonalization, and dissociative disorder, they're often told the treatment options are limited. Where I'm just saying, when there's a structural cause, obviously if you resolve the structural cause and you decrease the pressure in the brain, and the brain fluid flow is restored back to normal, there's a good chance that the brain's going to function more normally, and then the person's personality gets back to normal. Depersonalization is observing oneself from outside one's body. So in other words, the person just feels like they're living their life, but they're viewing it from the outside instead of me or you viewing it from the inside, right? And then derealization is a person's surroundings feel like they are not real, disconnected from people they care about. And I can often see this when people come in, like you'll have a child, and the child could be 25, but they're coming with one of their parents, and you could just see there's like a disconnect, almost as if the person has autistic-like activity, but they never had this before. You know, when they were 23, they're playing, you know, they're working, they have an active life, and then over the course of 2 years, 5 years, it's like you just see the person transition into somebody who they never were. And that's what I say, that when you have a change in your personality, please check, because it may be that it's not a brain problem, it's a neck problem, and neck problems can be, can be treated. You can change neck structure just by, changing one's computer height, not looking down as much. If you got ligament injury, get the ligament injury treated. This is Caleb, so he's a young man that came to see me. So you can see where see how he's blanking out episodes, and we're trying to wake him. And then then he eventually has where he has the movement disorder. Like, watch this. He'll all of a sudden be completely normal again. Okay, so we're watching him. See, now he's now he's like totally back to normal. And then whether on this video or another video, I did interview him, after he had received prolotherapy and everything. And he's doing, I just want you to know, he's just doing great. And there was even a time period where he couldn't even be in school, because he was at his chair and then he would fall off his chair because he'd have these episodes. So he fell off of his chair a couple times. He was diagnosed with the doctors who saw him before I saw him that the condition was psychological, where he's just a great kid, has a great family. You wouldn't sense in any way that this kid has a lot of stress, So I knew right away that it had to be structural, and then we documented that he did have a structural problem in his neck. He had a reversal of the neck curve, and then he had some ligamentous injury in his neck, which was treated with prolotherapy. And then we taught him all the different things that you need to do to restore your neck curve. And he's still doing exercises and things and being responsible with his neck curve. Then here, you're going to see a video with Cody, and I did interview Cody, so you could definitely go on our YouTube channel and just see how Cody's doing, but she's doing spectacular. And you're going to see different kinds of videos in the office. This is where we're actually monitoring her blood flow in her brain with different neck motions. And she also was told that she had a psychological condition that was causing her trembling and blanking out episodes, when really it was a structural issue where her blood flow to her brain was being affected. So I just encourage you to go see her video of how she's doing. She's doing really well. And she told me in the video that she wants to go into the healthcare field. Now we're going to do some slides related to vagus nerve stimulation. So the vagus nerve is what controls inflammation in the body. So if you wanted to research it, type in cholinergic anti-inflammatory system, and then refractory or progressive migraine seizure disorder. Vagus nerve stimulation has been shown to really decrease it quite a bit. So the FDA approved vagus nerve stimulation for chronic intractable migraine seizure disorder. And the vagus nerve has many, many effects on the nervous system. There's many, many different ways that the vagus nerve affects the brain. And one of the things that it does, it makes the brain very resistant for this extra electrical activity. And then this is a very interesting slide related to vagus nerve stimulation on various clinical symptoms and corresponding disorders. And I just put in there all the different kinds of things that you might think they're not structural, right? If somebody has post-traumatic stress disorder, or they have depression, generalized anxiety, autism, obsessive compulsive disorder, hyperactivity disorder, it's not common knowledge that the cause of these, or something that makes the symptoms of these disorders much, much worse, comes from the neck. So just think about that for a second. So even autism, post-traumatic stress conditions, and we'll talk about other kinds of movement disorders, they could have their etiology being a neck problem, right? So think about if the brain can't get rid of the waste products from all the metabolism that occurs in the brain during the day. Like what's supposed to happen is when you sleep at night, your jugular veins are supposed to be open. Then the brain is like a washing machine. As you get into the deep stages of sleep, the brain just whoosh, whoosh, like a washing machine, whoosh, get rid of all the waste products. The brain pressure goes down, and all of a sudden the parts of the brain that have to do with memory and learning, those parts of the brain then store those memories, store that learning, right? One of the things that we see at the Hauser Neck Center is that often people who have these things, they'll say that their memory isn't so good, they have terrible brain fatigue, their personality has changed, they have more obsessiveness, derealization, of course, anxiety and depression, and they just don't experience love. Like they just have a hard time having fun or having joy or love. Well, it turns out the vagus nerve runs right with the jugular vein, right? So the same process, which normally is the atlas, the top vertebrae is smashing into the jugular vein. Well, that's right where some of the ganglion are for the vagus nerve, most notably the nodose ganglion. So when that nodose ganglion gets hit, it affects the vagus nerve quite a bit. And the vagus nerve is a sensory nerve and a motor nerve, meaning that it takes the sensory information from inside the body, brings it up to the brain, and then when the brain wants the body to repair, to regenerate, to get rid of inflammation, to sense love, joy, happiness, that's all carried through the vagus nerve. So the vagus nerve is damaged. You could see where that could easily affect one's ability to have fun, their personality. They're not going to repair as good. And some of the patients will say, I'm just telling you, doc, it's as if like my whole body's breaking down. Like all of a sudden my knees clicking, my ankles clicking, all my body's clicking. That can be a sign that the vagus nerve is injured and the body can't repair itself as good, right? Because you don't realize all the tissues of the body are getting broken down every day and they need to be repaired at night during sleep. That's why sleep is so important. And when you have increased brain pressure, you can have a decreased ability to sleep, right? Because the brain pressure is high, the brain is sensing stress, it dilates the arteries, so it's as if you're awake and the brain is stressed. So even insomnia can be caused by compression of the carotid sheath, which occurs from ligamentous cervical instability. So if vagus nerve stimulation controls refractory seizures, could it be that vagus nerve degeneration is actually the cause? And the way we document this is through ultrasounds of the vagus nerve, and we find that people with mental health conditions, seizure disorders, tremors, they almost always have degeneration of the vagus nerves. Now, the potential mechanisms of action of vagus nerve stimulation is all these things. The vagus nerve, when you stimulate it, and there's lots of different ways to stimulate it. You don't necessarily need a stimulator. Every time you laugh, you're stimulating the vagus nerve. Every time you enjoy something, you're stimulating the vagus nerve. Every time you slow, deep breathe, especially slow exhalation, and it should be through your nose, that stimulates the vagus nerve. Humming, you listen to beautiful music, you're with people you love, you pet your cat, you sink a birdie putt, you're stimulating your vagus nerve. So if a symptom or a disease is helped by vagus nerve stimulation, could it be that vagus nerve degeneration is part of the cause? So look at all these diseases and symptoms that have been attributed to the vagus nerve or the vagus nerve being degenerated. Autoimmune disease, headache, cognitive issues, anxiety, epilepsy. So again, the vagus nerve runs in the carotid sheath on the anterior portion of the neck, right in front of the vertebrae. So if a person looks down at a cell phone excessively and there's ligament damage here, it means that the vertebrae are going to slide more forward, right? And then you're going to get tension in the neck. So if you have some of these conditions and you also know I have clicking, popping, grinding in my neck, and you have tension in your neck, you most likely have some type of cervical instability. And cervical instability often is not shown by static MRIs. You know, you need to do motion. So what we do is we move the neck and we do a fluoroscopic evaluation, which we call a digital motion X-ray, which will show the instability. And then you know exactly how much instability, you know where the instability is, and then that would determine how many visits of prolotherapy are needed and whether other treatments are needed, such as cervical curve correction. So I'm just going to go kind of quickly. There's different kinds of movement disorders, and I'm not in this video saying somebody has Wilson's disease or Huntington's chorea, or they have a genetic cause of a movement disorder and prolotherapy or vagus nerve stimulation is going to cure it. But I'm saying if you have a movement disorder, like say somebody has a movement disorder that's caused by Parkinson's disease, they have multisystem atrophy, cortical, basal, or degeneration. I can say this, that anything that helps the brain function better, opening up the jugular veins, getting the vagus nerve healthier, it's likely going to decrease the symptoms of these conditions. Isn't the main reason that we have medical care is to relieve human suffering, right? Sometimes we relieve it completely, sometimes we just help. So I'm not saying that, you know, somebody could do cervical curve correction and prolotherapy and their Parkinson's is going to get cured, but there's a good chance that, again, if you improve brain function by improving fluid flow into and out of the brain, it's likely the Parkinson's symptoms will decrease some. Like I had a person whose neck curve was so good when they looked up, and I said, and the person came to me because they had terrible symptoms of Parkinson's. So I said, here, let's just do something for fun. So I had the person close their eyes and look up, and I held them by the hand, and I'm like, let's walk. And in other words, when they did that and they walked much more normally than when they were doing the Parkinson and they're shaking and they're doing this or that, right? So that would be a person who, it's likely if we get their curve better, their Parkinson's is going to be a lot better. And there's just lots and lots of different conditions that cause movement disorders. I will say essential tremor. So somebody, it's very common, you could, you know, somebody's in their 40s and they're, you know, they're like this, or they'll go like this, and then they have the shaking. Sometimes, you know, the head will shake, and they've been diagnosed with essential tremor. If that's you, I'm just telling you, get checked out to see if you do have intracranial hypertension. And we diagnose it by non-invasive testing. So the two most common non-invasive tests that we do for intracranial hypertension is we check the pulsatile index of the middle cerebral arteries. And the pulsatile index is just basically the pressure against which the arteries in the brain have to push against to get a heartbeat. That's called pulsatile index. So when it's high, that's a sign of intracranial hypertension. Then 2 is optic nerve sheath diameter. So when the diameter of the eye nerve is increased, it means that there's fluid around the eye nerve. Well, the fluid is the cerebral spinal fluid. So why is the cerebral spinal fluid accumulating there? Well, it can't get out. Why can't it get out? Because the person has internal jugular vein compression. So we've had very good success of helping people get rid of their essential tremors. So to me, essential tremor, if you go on the internet, it seems like it's benign, but often it's progressive. So if the tremor is getting worse and worse, it must mean that something is getting worse. The disease that's causing the essential tremor is getting worse. And the cause of that is likely the internal jugular vein compression is getting worse, and that's from ligamentous cervical instability in the upper part. Restless leg syndrome, I was somebody who had that, restless leg. I think The structural cause of restless leg is that there's neural tension somewhere from the neck or the lower back. Like, think of this. The main time when you're extended is either when you're walking, but you're even more extended when you're laying down in bed, right? So restless leg is normally you're laying down in bed, you're all extended. It's almost like you get lumbar radiculopathy, but the legs are restless and you got to move them. But basically what you do is you flex your knees and you flex your whole body. Well, the cause of it, in my opinion, when it's a structural cause, is a loss of the neck curve and a loss of the lumbar curve. And both of those are caused by what? Slouching, right? When you're in a chair, isn't it true? When you go like this, like you're in a chair and you're not contracting your muscles, like when you contract your muscles, you have more of a chance to have a lordotic curve. So the lumbar curve is supposed to be lordotic, the neck curve is supposed to be lordotic. When you slouch, now I see the 3 gals watching me during this video, now they're all, you know, now they have good posture, right? But for the first 40 minutes of this taping, they were all getting ligament laxity because they're all slouching. When you slouch, you lose the lumbar curve. That elongates basically the nervous system. It elongates it. So if you lose your curve here and here, all of a sudden there's nerve tension, right? The main nerve tension is going to be what? On the distal nerve, right? The distal nerve, which is your feet, right? The sciatic nerve is longer than the nerve from the neck to here. So you feel the nerve tension. So basically, the treatment of restless leg syndrome should be what? Restore your lumbar curve, restore your neck curve. And then normally it goes away. Tourette's, I'm not saying you do structural work on your neck and the Tourette's goes away, but probably it's going to be helped. Symptoms associated with movement disorders, you know, basically the people can't control the movement. So anybody who has movements that they can't control should look at, do you have intracranial hypertension? Is there a fluid flow problem into or out of the neck? And that normally occurs because there's a neck problem. And then this is just an illustration. So cervical lordotic curve with normal cerebral spinal fluid around the brainstem, the spinal cord, right? And here, see how the neck structure has changed. We call this cervical dysstructure. The cervical dysstructure, beside blocking the jugular veins, can block the cerebral spinal fluid flow. And you can see this on MRIs. So often when people come for their initial visit, we'll show them that they have a block of the cerebral spinal fluid somewhere in the upper cervical region, and that could be a cause of their intracranial hypertension. And then when the cerebral spinal fluid accumulates in a certain part of the brain, so we're showing it here, normal, the fluid's accumulating in the frontal lobe. Well, you know the frontal lobe is where what? That's where you have memory fibers. That's what inhibits bad behavior. So if somebody has obsessive compulsive disorder, right, it may be that their frontal lobes aren't working good. So all of a sudden they're just doing something that's damaging. Like they're just obsessing about this, obsessing about that. You know, they don't want to go out of the house. They have irrational fears. And so on MRI, you might see that there's excessive fluid here and that there's atrophy of parts of the frontal lobe, but you don't necessarily have to show that. So then this shows that there's internal jugular veins. So somebody has a block of the internal jugular vein, the cerebral spinal fluid accumulates in the frontal lobe, then they get personality changes, their memory goes down, they're not thinking quite right. And then many times blanking out episodes are actually a type of temporal lobe seizure. And I used to see this quite a bit. I did 3 months of neurology at Heinz VA back in the day in the 1980s. And we would see people who had, like I said before, sensory type seizures where they might have weird sensations on one part of their body. They might see things that aren't there. They might hear things that aren't there, and it can be a type of temporal lobe seizure. Now, We talked previously about the vertebral artery. And again, this can be easily documented in the office that a person has kinking or compression of their vertebral artery. See how the vertebral artery is in the cervical vertebrae and then it wraps around the atlas to get into the brain. And so we check velocities at various locations in the vertebral artery. And if the vertebral artery is getting kinked in one area and the other part that's not getting kinked or compressed can't supply all the blood supply to the back of the brain, that's when you're going to have a symptom like vertigo, dizziness, fainting, visual type symptoms. This illustrates where they have excessive movement of the atlas and the vertebral artery gets kinked. When the atlas compresses, it can stretch the vertebral artery, but it also will compress the jugular vein. And what runs with the jugular vein, of course, is the vagus nerve. Then you have the trifecta, right? The same problem, ligamentous upper cervical instability, is causing compression of the jugular vein. Waste products can't get out of the brain pressure goes up. You get vagus nerve degeneration because, again, the nodose ganglion of the vagus nerve is there, and you can get kinking of the vertebral artery. So let's just say somebody has really bad instability at the right C1, C2. That means when they rotate their head to the left, then you're going to get excessive movement of the atlas. So it's rotation of the head to the left that kinks the right vertebral artery. So this, in some people, that's very, very helpful because a person might lay on their right side, right? When you lay on your right side, you tend to rotate your head to the left. So we might change just the position of sleep, or at least at minimum we tell them these are the danger motions until you get your ligaments tighten in the upper neck. Once the ligaments are tight in the upper neck, then of course they can move the head in whatever position they want. So one of the ways that we document whether a seizure disorder or a movement disorder or a tremor is from ligamentous cervical instability compressing an artery is by transcranial doppler or extracranial doppler. So in this particular patient, and this was a paper I wrote, it was on dystonic storms. So dystonic storms are kind of like, well, they are a type of seizure disorder in the sense that we documented that this particular patient, the blood flow had stopped, and 8 to 10 seconds after the blood flow to a certain artery of the brain stopped, and all of a sudden the person had the dystonic storms that nobody could document what the cause was, and this particular person also had been told that it was psychogenic. And then once we restored the neck curve and the person got stability, then the dystonic storms went away. See how they're curling, see how the movement, the different kind of movements. So if somebody saw this and the doctors couldn't document that there was excessive electrical activity here, they might think that the person is faking it or something. And this was clearly only occurred after the blood flow had stopped in a certain artery to the brain. Then all of a sudden, yeah, you could just see it. It's amazing. It's amazing, right? Like, it's totally not under the person's control. So we document it for them. So in the office, that's what we do. We like to videotape the person. So then this particular person and other people, when we've documented that it's a blood flow issue, vertebral artery or carotid artery, it's normally the vertebral artery, then they could show everybody, like, it's objective proof of that it's actually a structural problem in the neck. We had one particular person where they would move their neck a certain way, and then all of a sudden they would go 1 1 1 1 1 1 1 1 1 1 1 1. You know, because again, if it has to do with the speech part of the brain, right? The speech part of the brain, now all of a sudden they move a certain way, and then the the speech part has increased pressure, then you may just repeat a word. And it looks crazy, right? But the person isn't crazy. It's just the brain is autonomous in that the fluid flow has changed, so the brain can't function under your voluntary control, so it just starts taking over, doing things that look crazy, like a person's blanking out, they're not responding to you, or 11111, or you see this, like the thing curls in and then the person starts moving around, but it's actually all from one of the fluid flows, right? So again, you guys have seen this slide before, but again, it's a long video. So ligamentous cervical instability can cause fluid flow problems and cause all different kinds of symptoms: dissociative disorder, psychogenic non-epileptic seizure, partial seizures, complex seizures, generalized seizures. All different kinds of personality changes. Things where when a person gets the diagnosis, sometimes it can be devastating because the doctor says, you know, you have dissociative disorder, you have derealization, you have depersonalization. Then you go on Google and you're like, geez, there doesn't seem to be a cure for it. Yeah, but if you didn't have it, now you have it, there has to be a cause. So obviously if the person gets at the root cause, and I'm not saying all these disorders are just from a structural issue, but by the time people come here, they'll say that I have this, but I also have neck tension, I also have clicking, popping in my neck. Sometimes the people self-manipulate, you know, so obviously if you're one of those people that cracks your neck, you're likely giving yourself instability, or if you don't already have instability. All of these things are the person just doesn't feel at home in their own body, whether they feel like instead of looking out into the world as if they're watching themselves, and it can be very, very depressing for the person. And the person gets more and more where they want to just stay at home, they don't want to do anything, they lose their job, and with that becomes, you know, a lot of financial stress. And I'm just saying that in many cases it can have as a root cause ligamentous cervical instability, because the history of some of the people are that they were gamers, so they're spending hours and hours doing gaming, or their jobs were just, you know, thousands and thousands of hours in front of the computer with bad posture. Sometimes it's after a trauma that a person had, some kind of like a physical trauma, like they hit their head, they had a sports injury. And when you have a sports injury, like say you play football or soccer or lacrosse and you smash heads, you know, you smash somebody's head, they'll say, oh, you have post-concussion disorder. Again, they're assuming that it's a brain problem, but the brain problem could be secondary. When they smashed the head, when they smashed their head, they did a real quick twist, and that real quick twist caused upper cervical ligamentous injury, which then led to jugular vein compression, which led to accumulation of CSF and increased brain pressure. So the treatment should be directed at the neck problem. And it doesn't mean that brain therapies don't work. I currently now have probably 3 or 4 people that are doing various brain therapies which are helping, you know, but the root cause of it is in the neck. So many, many different kind of mental health illnesses. And again, I'm not saying schizophrenia, split personality disorder, bipolar disorder. If you correct the neck curve, everybody's going to get cured. But again, if you've had a massive change in your personality, as a teenager you were fine, as a 20-year-old you were fine, now you're a 26-year-old and you're not fine, something happened, something changed. And it's likely that what changed was your neck structure changed, and now your brain's not functioning good, so you got to get your neck structure back to the way it was. And if you do that over time, it's likely that the brain function's going to be back to normal and the symptoms going to go down. Cognitive distortions, meaning that memory's not the same, focusing isn't the same. What took you an hour to do now takes you 8 hours to do. Again, there's a change, right? Is it because I'm getting older? Because I got internal jugular vein compression, right? So if you have internal jugular vein compression, just restore the neck curve, get stability. The brain can then get rid of the waste products, and then the brain function can get back to normal. So all kinds of mental health illness things, personality changes, things that look like seizure activity or blanking out episodes, all these things can have as a root cause ligamentous cervical instability affecting the fluid flow. Now, some of you will be diagnosed with different kinds of disorders of the brain. There's two parts of the brain I want to mention. One's called the insular cortex and the other one's called the anterior cingulate cortex. I'm not going to go into detail, that will be for another video, but there's data that basically when you do a lot of gaming or you have addictions, you have a cell phone addiction, right? And those of you who your brains aren't functioning good and you know you have a cell phone addiction, you've got to try to get off of the cell phone. Only use the cell phone if it's helpful to you, right? One of the things that I watch is Dr. Hauser on YouTube. That is really, really interesting stuff. But even myself recently, I've realized like when I use my cell phone, I should use the same sense of principles that I live by, right? I try to live by one is whatever I do, I should do it for the glory of God. Like the Bible says, whether you eat or drink or whatever you do, do it for the glory of God. So in other words, is what I'm watching on the internet, is it something that's going to glorify God? And the second principle is it either going to help me or somebody else, right? Does it glorify God? Is it going to help me or help somebody? If we all do that, our screen time is probably going to go way down. So I'd really encourage you, because you can't just assume that your brain's going to function good. So those of you who the brains aren't functioning good, you've got to give the brain a rest, right? Obviously, I'm a little bit hoarse. I'm overcoming a cold, right? Well, one day I went to bed at 6:30. I got up at 5:30. The next night, I went to bed at 6:30 again, and I got up at like 7:30. 7 o'clock. So one day I slept 11 hours, the other one I slept 12 and a half hours, right? And that would have been the end of last week. So in other words, I worked at this office till about 5:30. By 6:30, 2 nights in a row, I was asleep. So what do you think would have happened if I didn't get rest to help my body overcome, the cold I was getting? I'd be a lot worse now, right? So if your brain is struggling, you have got to give the brain a rest. The best way you give the brain a rest is don't look at stuff on the internet. Like put your cell phone away or significantly reduce your screen time. Every time you look at something on the internet, it's like images and images and images that your brain has to work, and the brain has to work. Then the brain makes waste products. Then the blood supply to the brain has to go up because the brain's working so much. Then the jugular veins have to be massively open for you to get rid of all these waste products. So in the office here, there are definitely times where I'm like, especially when somebody's a new patient, I'm like, George, you have got to lay down in the position. So we check various positions and see what sleeping position works best for the person to open up their jugular veins, and they have to sleep in that position. Well, for me, because I have a right styloid, is my best position is when I am in bed, I'm on my right side, and I'm looking, my head's extended. Not everybody can extend their head because they get dizzy, but I can extend my head. My jugular vein opens. So when I'm having a busy day in the office here and I just feel exhausted, I'll just lay in that position like 5 minutes, or during the lunchtime, just 5 minutes. And it's, I close my eyes, deep breathe through my nose, and then just a few brain flushes, with the jugular veins open, like in 5, 6, 7 minutes, you feel so much better. So the worse your brain function, the more your seizures are affecting you, the worse your migraines, the worse the blinking out episodes, the more during the day you have to lay down, extend your head, open up your jugular veins, and help your brain pressure go down and help your brain wash away any metabolites. So sometimes some of the patients, it's 5 minutes every hour, right? So again, depending on how bad your situation is, so basically with increased brain pressure, what's happening is the volume of the anterior cingulate cortex and insular cortex is going down. So again, I'll do a video at a later date on those topics. The only reason why I put this in here is that there's very small centers of the brain that are in the middle of the brain, the insular cortex, the anterior cingulate cortex, where basically all the information that helps you make a decision, what you were taught as a kid, at the mosque, at the synagogue, at the church, all the moral teaching from those institutions, from your parents. So that information, your bad experiences in life, your good experiences, your emotional experiences, all this information goes to very small parts in the center of the brain. Two of them are called the anterior cingulate cortex and insular cortex. So it's my belief that things such as dissociative disorder, derealization, people who they're not as motivated as they used to be, right? It's these parts of the brain that are really, really struggling, and it's my opinion that increased intracranial pressure from jugular vein compression, from cerebrospinal fluid block, that these specific areas are just getting annihilated. And if they get annihilated, it means that you are having a more and more difficult time making good decisions, right? That's what we see, right? People are making really, really bad decisions, and it's like, why? Like, why is there not something inhibiting them, or why are they not obeying like all the moral teachings that they had when they were a kid? So it's these kind of things. And they've also found that you could have seizure disorder, like you actually could have epileptic seizures in these deep parts of the brain, but they're not picked up on EEG. That's what led me to put this in. So you actually could have, where you actually have formal seizure disorder, but it can't be picked up on EEG, and that's the insular cortex or the anterior cingulate cortex. Very, very important parts of the brain to make proper decisions. And this just kind of summarizes all the different parts of the brain that ultimately give input to the insular cortex or the anterior cingulate cortex. And if these parts of the brain aren't working good, memory isn't good, decision making isn't good, cognitive function isn't good, your personality isn't going to be good, because you're not going to do anything, or whatever you do, it's just going to be selfish in nature, right? Like, think about all the social behaviors that we're supposed to have as human beings, like being kind to one another, being respectful to one another, having discussions with honor and dignity, right? And we're not seeing that just as society as a whole. And I just think these parts of the brain where they're supposed to tell us, like, you don't talk to people that way, you don't raise your voice, you're kind and respectful. I just think it's happening to pretty much everybody, and it's because we're basically becoming addicts to the cell phone, and the negative changes that are occurring because of the forward head, face down lifestyle. It's not allowing the fluid flows into and out of the brain to be correct. And I just put this on here just again to remind us that seizure disorder is where there's electrical activity in the brain and the brain can't control it. This is how they typically treat seizure disorder, is usually by drugs. Some people use a ketogenic diet. Lifestyle is where you reduce one's stress. You do things that we call a pro-vagus lifestyle, laughing, being around people that you love, be outside, limit electronic devices. If you're going to use electronic devices, do it in a manner where the neck curve is attenuated. Try to sleep in a position where, again, you restore the neck curve. Neurostimulation is vagus nerve stimulation that I talked about earlier. Once in a while, refractory seizures, you actually need to have surgery. This is how we look at it. We look at it that you do dynamic upright radiographic studies, which we call digital motion X-ray. It'll show the shape of the neck curve. We'll do jugular vein studies to see whether the carotid sheath is getting compressed. We'll look for intracranial hypertension. And then if we find through all the analysis the main problem is ligamentous cervical instability, we'll do prolotherapy. Usually people have problems with their neck curve plus instability, so we'll do a combination of a looking up lifestyle. We'll do ergonomics, and I would encourage anything you do for a prolonged period of time, whether it's computer work, driving, if you drive, set up where you restore your lumbar curve, you have something that's restoring your neck curve, and definitely make sure your computer setup at work is helping you have normal spinal alignment. When somebody doesn't have instability and they just have a breakdown of the neck curve, we again do things which we call cervical curve correction. And when there's misalignments, somebody could get upper cervical gentle vertebral adjustments. We don't recommend where somebody has high velocity rotational adjusting because that could lead to more instability. And again, this is try to look up at your cell phone, make sure your computer height's high. This is a good way to look at your cell phone if you want to look down at your cell phone. And then of course prism glasses, make sure you get some prism glasses, and you could see how high my computer setup is. And then make sure that you sleep in a position where you're restoring your neck curve. Maybe get a Derealization pillow or a pillow with a cutout. There's Izzy with some neck weights to restore her neck curve. The Derealization there, we shown with her that that helps restore her neck curve. And of course, if you need prolotherapy injections are done to the injured ligaments. The most common ligaments in the neck that are injured, that are restored with prolotherapy, are the capsular ligaments. So if you have movement disorder, seizure disorder, blanking out episodes, tremors, it may be that your problem is in your neck and it's not in your brain. If it is in your neck, you need to do restorative treatments that improve your cervical neck curve. And if there's ligament injury, prolotherapy to those ligaments will tighten and strengthen them so you can get your ligament instability resolved and your stability of your neck restored.